Hey everybody, hope you all are doing well as usual. And today we're going to talk about socioeconomic status in relation to health and health outcomes as we continue this medical sociology course. So we are going to talk about all things socioeconomic status. We've mentioned a bit about it. We have talked about the impacts of socioeconomic status as a social determinant of health. But now we're going to talk specifically about it, dedicate this session specifically to socioeconomic status and health. So I want to first cover its three components. I really want to begin this session by breaking down the concept of what socioeconomic status is into its three components. You can see its three components there, starting with number one, income. Income determines access to basic needs such as housing and nutrition and healthcare services. So income is part one of socioeconomic status. Part two, education. So this is what shapes health literacy, helps to shape employment opportunities and decision-making regarding health behaviors. So income, education, 2/3 of the socioeconomic pie. The third piece that comes together to really create socioeconomic status and our concept and our understanding of it is occupational status. Remember, we talked a little bit about status in that first week, or that maybe the second week, the first session, where we talked about some of the key elements of what goes into sociology we're studying. So occupational status, this influences exposure to workplace hazards, job stability, and access to employer-provided health benefits. So think about income. What are you bringing in? What is the resources that you're bringing in to meet these needs? Education, shaping your literacy and employment opportunities, what education you have and your ability to perceive things and your discern knowledge and gain knowledge. And then occupational status, things like what is your job? Does your job have a lot of workplace hazards? Do you have job stability relating to income? What income you're going to have? Does your employer provide health insurance? Those sorts of things. So these are the things that go into socioeconomic status, especially as we think from a health standpoint. And so I want to emphasize that these components are very interconnected, clearly, and they collectively shape an individual's social position and social experience, which directly and indirectly impacts their health. So for instance, people with higher socioeconomic status often have better access to healthcare, safer living conditions, and healthier lifestyles, whereas lower socioeconomic status is frequently associated with limited access to resources and higher stress levels and greater exposure to environmental and occupational hazards. So that's a good framework for how we're going to be thinking about this. So again, thinking now specifically about socioeconomic status and health. So let's begin by, we already broke down the socioeconomic status into its three components. Now let's talk about these terms specifically. I want to highlight the term of socioeconomic status as well as health disparities, because we're talking about both of those things. So socioeconomic status, again, kind of going back to that previous slide, but it refers to a multidimensional measure of an individual's social and economic standing encompassing income, education, and occupation. Remember, we talked about that, the three key elements: income, education, and occupational status. Health disparities refers to the differences in health outcomes across population. This is often reflecting broader social inequalities. And so how and why socioeconomic status impacts health. So I want to highlight how socioeconomic status impacts health through a few different key pathways. One, I'm going to talk about, you can find this in the notes under the slides, but one, material resources. Two, health behaviors. Three, psychosocial stress. And then four, access to healthcare. Let's start with number one, material resources. Higher income individuals can afford more nutritious food, safer housing, preventative care, timely medical treatment, whereas lower income groups may face issues around food insecurity, substandard housing, and delayed medical care due to different cost barriers. So we think about material resources, that's what we're considering. Health behaviors, number two. This is talking about how education influences health literacy, shaping behaviors such as exercise and diet, and even smoking behaviors and smoking cessation efforts. And individuals with lower education levels may lack some awareness around these preventative measures or face behaviors around actually implementing them. So that's two around health behaviors. Number three, psychosocial stress. So low socioeconomic status is associated with chronic stress due to financial instability and job insecurity and discrimination even. And this chronic stress can lead to poor mental health and an increase and risk of chronic diseases. Things like diabetes and hypertension all are contributed to this psychosocial stress. That's number 3. Finally, number 4, the key element I want to talk about here and how socioeconomic status affects health, access to healthcare. So socioeconomic status determines access to quality healthcare, with disparities around things like insurance coverage or insurance provider availability or healthcare provider availability and treatment options. And so in the United States, for example, people with low socioeconomic status are much more likely to be uninsured or underinsured. So having just basic access to meet our basic healthcare needs, including preventive visits, including emergency visits, including surgeries, pharmaceutical needs. These things are more restricted in terms of access with folks of lower socioeconomic status. So these are the pathways and key pathways of how socioeconomic status affects health. So remember, we have 1, material resources; 2, health behaviors; 3, psychosocial stress; and 4, access to health care resources. And I want you to think about something. I want you to think about is, why do you think someone's social and economic position would impact their health, right? Think about those examples I mentioned. What specific factors might contribute to this? So really think about, again, those key factors that I just mentioned: material conditions, like access to food, housing, transportation, stress and mental health, the psychological burden of poverty or job insecurity or financial instability. Healthcare access, again, basic things like affordability and availability of that. And then you think about even environmental factors, so exposure to pollution or unsafe neighborhoods. All of these things would contribute to a lot of these. So a couple of key takeaways here is that socioeconomic status, there are 3 key takeaways from this component. Socioeconomic status is one of the strongest predictors, just statistically, of health outcomes across time and population. And then what this does, it reflects these systemic inequalities here. And so health disparities are not just about individual choices. They are shaped by broader social, economic, and environmental factors. We've been talking about that from day 1. And socioeconomic status is a critical factor here. And so addressing these health disparities requires focusing on the social determinants of health, such as income and education and occupational conditions. Socioeconomic status is critical. It's one of the foundational pieces here of medical sociology and how we're looking at this. So let's explore this a bit further, exploring the socioeconomic status and health links. So you see some key links identified up there. And this comes from that Cochrane chapter 3 reading, where the author is examining the relationship between socioeconomic status and health outcomes, really emphasizing in this reading that lower socioeconomic status is typically associated with worse health-related outcomes. And so the Cochrane explores several factors contributing to this link, including the ones you see up there. So let's dive into them a little bit. 1, access to healthcare. So people with lower socioeconomic status oftentimes lack adequate health insurance or access to medical care, which can prevent them from receiving timely treatments or preventative care. So this often leads to late diagnoses and poor health outcomes, the things that come with those components. That second one there, environmental exposures. So lower income individuals may live in neighborhoods with higher levels of pollution, unsafe housing conditions, or limited green spaces, all of which can negatively impact both the physical and mental health of these individuals. And then the third up there, the psychosocial stressors. So here are things like financial instability, job insecurity, and discrimination. These things can cause what we call chronic stress. And chronic stress has been shown to contribute to a range of health issues, including heart disease, including diabetes, including mental health disorders. So these are some key areas here where we're exploring how socioeconomic status is directly linked to health outcomes and negative health outcomes for lower socioeconomic status individuals. So Cochrane in the reading also highlights that socioeconomic status doesn't just impact physical health, right? It also impacts psychological well-being. So people from lower socioeconomic status backgrounds oftentimes experience feelings of social exclusion or low self-esteem or chronic anxiety, all of which can further exacerbate health problems. So just diving again a little bit further here, it is crucial to stress that lower socioeconomic status doesn't only lead to worse physical health, but it also includes that mental health component. That's really critical, and I want to hit that home strongly. That continuous exposure to stress and uncertainty in everyday life for those with lower socioeconomic status can impair one's ability to cope with challenges affecting both their overall health and their quality of life. So I want to talk about a couple of key areas here as well. So a couple of key points to emphasize further. One, health risks for health risks in lower socioeconomic status groups. So people in low socioeconomic status groups may face some of the things you already mentioned, like higher exposure to environmental hazards, like toxic chemicals or unsafe living conditions and polluted air. So this directly impacts their health by increasing the risk of conditions like asthma or lead poisoning, chronic respiratory disease. So think about that. Where you live, where you can afford to live. People who can't afford to live in nicer, quote unquote, nicer areas or oftentimes more polluted areas or unsafe areas. These things contribute to this. Healthcare access is another area that I want to hit home. That those in lower socioeconomic status groups often lack those access to healthcare services, right? Or face even financial barriers like the cost of insurance or the cost of co-pays or travel to healthcare facilities in and of themselves. And so without this proper medical care, health conditions are often, like we mentioned, undertreated and underdiagnosed or even ignored. And that just leads to worse health outcomes. That psychosocial stress that I mentioned as well, again, want to hit on this, is that stress associated with things like financial insecurity or job instability and social marginalization. These things can take a really significant toll on mental and even physical health. That chronic stress is linked to higher blood pressure, increased risk of heart disease, and mental health issues like depression and anxiety. So all those things contribute to both the psychological and physical health of individuals. And then finally, just want to hit home the cycle of socioeconomic status and health. You're probably starting to put those pieces together, right? As this cyclical nature here. All this stuff that we've talked about, what it does, it creates a vicious cycle. Where poor health reduces the ability to work or obtain better paying jobs, which in turn worsens a person's socioeconomic status, leading to further health deterioration. So you see that it's hard to break this cycle. And this all goes back to what have we been talking the past few weeks, the past few sessions, is that we need more upstream efforts that tackles the root causes to health disorders. So those downstream efforts that provides people treatment or even better access to treatment, it doesn't get to the root cause of socioeconomic status and the ability to, or the impact of, if we address issues around socioeconomic status, we can address issues around health disparities. But until we do that more holistically, this cycle simply continues. So be thinking about that. Again, as it's just some key takeaways here is that socioeconomic status is a major determinant of health. We talked about how lower socioeconomic status is linked with poor physical and mental health. And then number two, health risks associated with lower socioeconomic status, things like exposure to hazardous environments, limited access to healthcare, and then those psychosocial pressures as well. And then finally, that socioeconomic status affects both physical and mental health. I want you to remember those three key things. And again, in the notes under these slides that are posted in the Moodle page, you have all of that information as well. Let's talk a little bit further again of socioeconomic status as a determinant of health behaviors now. So this reading, this information really comes from the Barkin chapter 3. It was a few pages there discussing how socioeconomic status influences health behaviors with lower socioeconomic status groups, often engaging in behaviors that are detrimental to health, like smoking or poor diet or lack of exercise. And this reading emphasizes, Barkin here emphasizes how financial constraints and a lack of access to information or facilities, things like safe parks or quality grocery stores, these things contribute to these behaviors. And so I want to emphasize that lifestyle choices are not simply individual decisions. We have to think sociologically. We have to use that sociological imagination and think more broadly. So lifestyle choices are not simply individual decisions. They are influenced by things like socioeconomic status. So for instance, lower income neighborhoods may lack access to healthy food options, making it more difficult for residents to maintain a healthy diet. It's a lot more, if you don't have affordable produce, for instance, it's a lot more convenient or affordable even to feed your family with McDonald's than it might be to buy really high quality, maybe organic or healthy produce from a grocery store. So those are the types of things we have to think about. And so how might you think about how limited resources or living in certain neighborhoods make it harder for someone to make healthy choices? Thinking about that. And some key takeaways are listed there on the slide is that socioeconomic status shapes health behaviors by influencing access to resources and opportunities. And then number two, barriers related to income and environment oftentimes restrict healthy behavior, healthy lifestyle choices for those with as lower socioeconomic status individuals. But let's talk a little bit further about the Barkin rating. Again, as socioeconomic status as a determinant of health behaviors, not just health outcomes, health behaviors. So I want to reinforce that again, health behaviors like diet, exercise, smoking, and preventative healthcare use, they are not solely determined by personal choice, but are deeply influenced by structural and environmental status tied to socioeconomic status, and environmental factors tied to socioeconomic status. So Barkin's chapter here, chapter 3, provides a really useful framework for understanding how socioeconomic status shapes these behaviors. So some key points that I want you to take away from the reading. Number one, financial constraints. So this is talking about how people in lower income groups often have fewer financial resources to prioritize health-related choices. For example, limited budgets may prioritize calorie-dense or low-cost foods over fresh, nutritious options. And even things like gym memberships or recreational activities may be viewed as unaffordable luxuries with these financial constraints. Number two, environmental barriers. So food deserts. We've been talking about food deserts throughout the course a bit. Lower income neighborhoods oftentimes lack access to grocery stores with fresh produce. Instead, having convenience stores, to rely on convenience stores stocked with more processed foods. That's what we're talking about when we think of food deserts. And then even safe spaces for exercise, right? So as an environmental barrier, where high crime areas or poorly maintained parks can really discourage outdoor physical activity. Number three, health literacy and information. So education, again, one of those three key components of socioeconomic status we talked about at the beginning, influences awareness and understanding of healthy behaviors. And so limited knowledge about nutrition and exercise or the risks of things like smoking or vaping can result from lower education levels. And then finally, number four, stress and coping mechanisms. Chronic stress is linked to financial or job insecurity quite often, right? That type of stress can really be produced from those situations. So this type of chronic stress linked to those things can lead to behaviors like smoking or overeating as even coping strategies for that stress. So again, think about not just how socioeconomic status is a determinant of health outcomes. Now we're diving deeper and seeing how that impacts actually specific health behaviors and decision-making processes. Clarifying the role of socioeconomic status in health behaviors. So one, let's deconstruct the myth of quote unquote choice. So again, the reading here explains that while behaviors like smoking or a poor diet might seem like those personal decisions, they are very much shaped by external factors. People with more resources can afford to make healthier choices more easily. That's what I want you to get out of this and really hit home there. So consider the cost of eating healthy. How does $5 at a fast food chain compare to $5 spent on fresh fruits and vegetables? Think about the quantity of food. When we're thinking about folks in greater socioeconomic disparities and needs and maybe in poverty, you need those calories to feed your family. You need to get the most bang for your buck, essentially, in terms of just basic caloric intake. Also think about like how disparities in recreational infrastructure, like the affordability of bike paths or gyms or sports programs in affluent versus low income areas. Think about those disparities. That's, again, a huge element here of how it's not just about individual decision-making, it's that our decision and our resources available to us are highly influenced by the world around us. And so I want you to connect these barriers that we're talking about to long-term health outcomes. Think about rates of obesity, diabetes, cardiovascular disease. Among these lower socioeconomic groups, it goes back to, again, that cycle where it's a cyclical thing, where these things contribute all to those long-term health-related outcomes. So I want you to think again, how might those limited resources be of impact in these these areas of lower socioeconomic status? So I want you to brainstorm and even discuss amongst yourselves, or happy to discuss with you, the cost of healthy foods versus processed foods, the impact of unsafe neighborhoods on physical activity, how limited transportation options might restrict access to grocery stores or healthcare facilities, and then even the psychological toll of poverty or stress, which can lead to prioritizing more immediate comfort, like comfort foods, over long-term health related decisions. So a couple of key takeaways, three key takeaways here. One, that socioeconomic status shapes access and choices. Again, dispelling and deconstructing that myth of choice. So lower socioeconomic status individuals oftentimes face structural barriers that restrict their ability to engage in healthy behaviors. And that health behaviors are not entirely individual choices, but are influenced by income, by education, and by environment. Number two, environmental and resource barriers. So food deserts and lack of safe recreational spaces and limited transportation options are common obstacles in these lower income neighborhoods. And then three, the role of stress. So chronic stress is linked to low socioeconomic status. And that chronic stress linked to low socioeconomic status, it exacerbates unhealthy behaviors and turns them into coping mechanisms for financial or social strain. So think about those three aspects and how we deconstruct that myth of just choice alone, and think about the broader systemic barriers that extend far beyond individual willpower here. All right. The psychological and physical health effects of socioeconomic status. So this comes from the Wang and Gang 2019 reading. This is, and what these authors are examining is they're examining the impact of socioeconomic status on both physical and psychological health, and noting that socioeconomic status influences health through these various multiple pathways. We've been talking about that, including lifestyle choices and stress levels and access to resources. And this study also highlights the mediating role of lifestyle factors like exercise and diet and smoking in the relationship between socioeconomic status and health. So they take those into consideration. So the study found that this Wang and Gang study found that low socioeconomic status can lead to poor health outcomes through both direct and indirect pathways. So think of direct pathways as like access to healthcare, and indirect pathways, things like stress and lifestyle choices. So I want to point out as well that lifestyle choices are often constrained by socioeconomic status and are influenced by one's social environment and available resources. So think about what are those most significant lifestyle factors that can mediate the relationship between socioeconomic status and health. What are those things? Think about maybe in your life or experiences that you can think of, as well as from the reading. And so again, those key takeaways, you see them up there on the screen, is that socioeconomic status impacts both physical and psychological health, as we've continued to talk about, and that lifestyle factors can mediate the relationship between socioeconomic status and health outcomes, meaning that they partially explain how socioeconomic status influences health, those lifestyle factors. So again, we're talking about the impact here on both physical and psychological health, and how socioeconomic status influences those things both directly and indirectly. A couple of key findings from this article that I want to highlight as well. Number one, that direct pathways of socioeconomic status impact the direct pathways impact on health. So number one of a direct pathway example is access to healthcare. So lower socioeconomic status individuals may lack access to quality healthcare services due to financial barriers or inadequate insurance. And then a second component here of direct pathways would be resource availability. So high socioeconomic status individuals have greater access to health promoting resources such as nutritious food and safer housing and healthcare providers, those sorts of things. Number two down there, indirect. So rather than direct, which you just talked about, indirect pathways of socioeconomic status and the impact on health here. One example of an indirect pathway would be chronic stress. So how we've talked about that low socioeconomic status is associated with higher levels of stress due to financial insecurity, job instability, and unsafe living conditions. And that chronic stress negatively impacts the body, the physical health, and contributing to conditions like hypertension and heart disease and a weakened immunity. And another example of an indirect pathway would be psychological health in general. So low socioeconomic status is linked to higher rates of depression and anxiety and other mental health challenges. Number three now, listed there, lifestyle as a mediator. So this is an important piece to consider, that lifestyle factors like exercise and diet and smoking do mediate the relationship between socioeconomic status and health. So high socioeconomic status individuals are more likely to adopt health promoting behaviors due to better access to information, facilities, and a more supportive environment. So, but conversely, low socioeconomic status environments may foster more unhealthy behaviors due to limited resources or as coping mechanisms for stress, things like smoking and overeating. So those are three key findings three key takeaways from the Wang and Gang article. I want to continue on this, the mediating role of lifestyle. Again, we talked about some of the other components here, that direct pathways, indirect pathways, and lifestyle as a mediator. Let's dive in a little bit further yet. So again, clarifying this role. There's three key components on top, and then I've got more takeaways. So number one, lifestyle is influenced by socioeconomic status. So I want to, again, the health behaviors, things like exercising regularly and eating healthy are shaped by social and economic context, not just individual willpower. So for example, a low-income individual may prioritize immediate financial needs over gym memberships or organic produce, right? Kind of like Maslow's hierarchy of needs at this social scale. You got to prioritize what's just going to keep you afloat at this point. And those things like gym memberships or organic produce, those things are not going to be as high on the list. It's just providing basic food and as much food as you can afford to you and your family. Number two, stress as a catalyst for unhealthy behaviors. So I want to highlight here how stress from financial or job insecurity does lead to and can lead to behaviors like smoking or excessive alcohol consumption as coping mechanisms. And then that third there, the interplay of psychological and physical health. So I want to point out that poor mental health, such as anxiety and depression, due to socioeconomic status related stress, can contribute to physical health issues, creating a cycle of worsening outcomes. We talked a bit already, right, about that cyclical nature there. So be thinking about those three key elements, and think about, a question of what role does diet play in long-term health outcomes? How does the availability of safe spaces for exercise vary between high and low income areas? How might chronic stress contribute to unhealthy behaviors like smoking or eating? And then even how are psychological effects like stress and depression more impactful than physical barriers in shaping health outcomes? I want you to be thinking about all of those three key questions and then incorporate that maybe into your discussion prompt for the week. So I really encourage you, if you do this in your discussion prompt or in papers, to draw on examples from your communities or from news stories that highlight these dynamics. And then just a couple of other key takeaways there that I'd like you to make sure that you're bringing back from this reading is that socioeconomic status directly and indirectly influences health. So direct impacts include access to healthcare and access to resources. Your indirect impacts involve stress levels and resulting psychological health challenges. Number two there, that lifestyle is a mediator. So healthy behaviors, things like diet and exercise, partially explain the link between socioeconomic status and health outcomes. Low socioeconomic status often restricts access to health promoting behaviors, while high socioeconomic status oftentimes facilitates them. And then three, and finally, that psychological and physical health are interconnected. That poor mental health due to socioeconomic status related stress can and does exacerbate physical health issues, creating, again, this cycle of disadvantage, we will call it. And so I want you to have that understanding of how socioeconomic status impacts both physical and psychological health, and how they're both indirect and direct pathways, and how lifestyle factors, like in this reading, do mediate this relationship. And we also need to recognize the importance of addressing structural barriers to improve health equity. That's what we're building to. As we understand this more, we can address this at a more structural level. So just finally, to talk about the cumulative disadvantages, the disadvantage of health disparities. This comes from the Barkin Chapter 5 reading. And what the reading does, Barkin introduces the concept of what we call cumulative disadvantage, where disadvantages are compounded over time, leading to greater health disparities as individuals age. So this cumulative disadvantage means that people with lower socioeconomic status face mounting health risks over their lifetime. That is not just a baseline. Is that people with lower socioeconomic status, the disadvantages increase and add up in a mounting effect. So this cumulative disadvantage refers to that process where disadvantages accumulate over time, often resulting in poor health outcomes in later life. For instance, low income individuals may experience chronic stress or limited access to preventative health care, and that increased exposure to harmful environments too. So all of which contribute to worsening health as they age. So it piles up, and it's a building cumulative effect. So think about those cumulative effects over time, and these key takeaways that you see on the screen, that health disparities oftentimes grow over time due to this cumulative disadvantage that is highlighted in the Barkin Chapter 5 reading. And then that addressing cumulative disadvantage may help reduce long-term health disparities associated with socioeconomic status. All right, finally, just a quick wrap up and synthesis. I just want to review these three key main points from the session. One, that socioeconomic status is a key predictor of health outcomes, influencing both physical and mental health through various direct and indirect pathways. Number two, lifestyle factors mediate the relationship between socioeconomic status and health, but they are often constrained by social and environmental factors related to socioeconomic status. And then three, the concept of cumulative disadvantage helps to explain how socioeconomic status related health disparities grow and grow over time. And so I just want to ask you all this reflection prompt. Maybe you can include pieces like this into a discussion prompt, or we can have one-on-ones about this. But if you could change one factor to reduce health disparities caused by socioeconomic status, what would it be and why? All right, that's it for today. Appreciate you tuning in again. As always, as we can continue to do and have continued to do, please reach out to me for any one-on-one conversations, connects, and things like that, and any questions that you do have. Thanks again, everybody, for tuning in today.